And that is how we can convince the donors to put more dollars to these kinds of initiatives. So that's one, we really need to be keeping on advocating and championing and knocking on the door and even knocking on the window if we really want to make sure that we have more resources for our work on climate and health. Having said that, I think we also have opportunities to explore how we can incorporate climate change into our existing, funding streams and projects. For example, if you're working on tuberculosis, start thinking how to make tuberculosis programming in your locale, in your countries, more climate resilient, more climate considerate. Same thing for HIV/AIDS. Same thing for, let's say, vaccine preventable diseases. So we have to, I guess it's an invitation to being more creative and being more, forward looking in terms of applying a climate lens into our existing projects while we're still looking for more money to address some of the emerging, climate and health challenges that we're facing, which may not be covered yet by traditional, global health funding. And also, of course, we need to influence government funding for, climate resilience building and health system strengthening. For example, in my home country, the Philippines, what we're seeing is that there's money for climate, there's money for health, but they are not talking to one another. And so the challenge is how to find ways to increase the synergy between our health financing and our climate financing, because one, many of the solutions are at the nexus, at the intersection. And number two, if we invest in climate adaptation, we will improve people's health. And if we strengthen the health system and address the diseases, we will also protect people from climate change. So I hope this is sufficient, advice on how to navigate these new complex spaces.
Thank you, Renzo.